Hello, and welcome to the Everyday English Lounge. My name is Avery, and I'm here with my wonderful co-host, Chloe.
Hello, everyone. It's lovely to be here. Today, we have a very useful topic for you. We are going to talk all about doctor visits. Specifically, how to describe your symptoms clearly and get the help you need quickly.
That's right. And this is such an important topic because when you're not feeling well, you need to communicate effectively with your doctor.
Exactly.
Whether you're living in an English-speaking country or traveling abroad, knowing the right words and phrases can make a huge difference.
Absolutely. So today, we'll cover common symptoms, how to describe pain and discomfort, useful questions to ask your doctor, and how to understand prescriptions. Let's dive in.
Let's start with the basics. When you visit a doctor, you need to describe how you're feeling. Chloe, what are some of the most common symptoms people talk about?
Great question. Let's begin with general symptoms. You might say, I have a fever, or I'm running a temperature.
Right.
Both mean your body temperature is higher than normal.
Right, and you can be more specific too. For example, I have a high fever or I have a slight fever. The word slight means it's not too serious.
Exactly. Now let's talk about pain. There are different types of pain, and it's important to describe it accurately. You could have a headache, a stomach ache, or a backache. Notice how we add ache to the body part?
Yes, that's a useful pattern, but sometimes we use pain instead. For example, I have chest pain or I have pain in my shoulder.
That's true.
You can also say my chest hurts or my shoulder is killing me. That last one is informal and means it hurts a lot.
Good point. Now let's talk about describing the type of pain. Is it sharp, dull, throbbing? These adjectives are really important.
Yeah, those are key.
A sharp pain is sudden and intense, like a knife. A dull pain is less intense but constant. A throbbing pain feels like it's pulsing.
Perfect examples. Let's practice a sentence. I have a sharp pain in my lower back that started yesterday.
Excellent. Now, other common symptoms include cough, sore throat, runny nose, and congestion.
Ugh, congestion.
Right? If you're congested, it means your nose is blocked and you can't breathe easily.
Right. You might also experience nausea, which means you feel like you might vomit, or dizziness, which means you feel unsteady or like the room is spinning.
And don't forget about fatigue or exhaustion. Both mean you're extremely tired. You could say, I've been feeling exhausted for the past week.
One more important phrase, I'm not feeling well, or I'm feeling under the weather. Both are polite ways to say you're sick.
I love that one, under the weather. Now that we know the vocabulary for symptoms, let's talk about describing when they started and how they developed. This information helps doctors diagnose you correctly.
Absolutely. You'll often hear doctors ask, when did this start? Or how long have you been feeling this way?
Right. You can answer with phrases like, it started yesterday. I've had this for 3 days, or it began last week. You can also say it came on suddenly if it happened all at once, or it developed gradually if it got worse over time.
Good distinction. Here are some example sentences. I woke up with a sore throat this morning. Or I've been coughing for the past 5 days and it's getting worse.
Perfect. Doctors also want to know about the severity. You can say it's mild, it's moderate, or it's severe. For example, the pain is moderate, but it's constant.
And you can describe patterns too. The headache comes and goes means it appears and disappears.
Right.
It's worse in the morning, or it gets better after I eat. These details are really helpful.
I've had a throbbing headache for 2 days. It started suddenly on Monday morning, and it's worse when I'm in bright light.
Excellent. That gives the doctor a clear picture. Another useful phrase is to mention if anything makes it better or worse. For example, the pain improves when I lie down, or it gets worse when I move.
Yes, and don't forget to mention any other symptoms that might be related. You could say, along with the headache, I've also been feeling nauseous, or I have a fever and body aches as well.
Now, let's move on to what actually happens during a doctor's visit. Chloe, can you walk us through a typical conversation?
Of course. Usually, the doctor or nurse will start by asking, "What brings you in today?" or "What seems to be the problem?" This is your chance to explain your main complaint.
Right. You might respond with something like, I've been having chest pain, or I think I have the flu. I've had a fever and body aches for 3 days.
Good. Then the doctor will ask follow-up questions to get more details. They might ask, where exactly is the pain? Or can you point to where it hurts?
And you can be very specific. Instead of just saying my stomach, you could say my upper abdomen or the right side of my stomach. You can also use your hands to point and say right here.
Exactly. They'll also ask about the intensity. On a scale of 1 to 10, how bad is the pain? Be honest. If it's a 7 or 8, say so.
Another common question is, have you taken anything for it? The doctor wants to know if you've tried any medication. You might say, I took some ibuprofen, but it didn't help, or I haven't taken anything yet.
Good point. They might also ask, do you have any allergies? This is very important. You need to know how to say, I'm allergic to penicillin, or I have no known allergies.
Right, and they'll ask about your medical history. Have you had this before, or do you have any chronic conditions? Chronic means long-term, like diabetes or high blood pressure.
Let's practice a dialogue. I'll be the doctor and you'll be the patient, Avery.
Sounds good.
So, what brings you in today?
I've been having a terrible sore throat for 4 days, and now I have a fever too.
I see. How high is your fever?
It was 100 degrees this morning.
And the sore throat, does it hurt when you swallow?
Yes, it's very painful, especially on the right side.
Have you noticed any other symptoms?
I've been feeling really tired, and I have swollen glands in my neck.
Okay. Have you taken anything for the pain?
I've been taking acetaminophen, but it only helps a little.
Excellent dialogue. That's exactly the kind of information doctors need.
Thanks. Now, listeners, notice how I was specific about the location, the severity, and what I'd already tried. This helps a doctor make a diagnosis quickly.
After examining you, the doctor will give you a diagnosis and possibly a prescription. Let's talk about understanding this information.
Right. The doctor might say you have strep throat, or it looks like you have a viral infection. A viral infection usually goes away on its own, but bacterial infections often need antibiotics.
Exactly. If you don't understand the diagnosis, don't be afraid to ask. You can say, could you explain that in simpler terms? Or what does that mean exactly?
Great advice. Now, about prescriptions, the doctor might say, I'm going to prescribe an antibiotic, or I'm writing you a prescription for pain medication.
When you get a prescription, there are important things you need to know. First, the dosage. Take 1 tablet twice a day, or take 2 pills every 6 hours.
Yes, and you need to know for how long. The doctor might say, take this for 7 days, or continue until the bottle is finished.
So important.
It's very important to complete the full course of antibiotics, even if you start feeling better.
Absolutely. You should also ask about timing. Should I take this with food, or can I take this on an empty stomach? Some medications work better with food, others without.
And ask about side effects. You can say, what are the possible side effects? Common side effects include drowsiness, nausea, or dizziness.
Right. The doctor might say, this might make you drowsy, so don't drive. Or you might experience some stomach upset. Take it with food to minimize that.
Here are some other important questions to ask. Can I take this with my other medications? Or are there any foods or drinks I should avoid while taking this?
Excellent questions. Let's practice. I'll be the doctor again. Avery, I'm prescribing amoxicillin for your strep throat. Take 1 capsule 3 times a day for 10 days.
Okay, should I take it with food?
You can take it with or without food, but if it upsets your stomach, try taking it with a meal.
Are there any side effects I should watch out for?
You might experience mild diarrhea or nausea. If you develop a rash, stop taking it immediately and call me.
Got it. And I need to finish all 10 days, even if I feel better?
Exactly. Even if your symptoms improve after a few days, it's crucial to complete the full course.
Perfect dialogue. Those are exactly the kinds of questions you should ask.
One more thing. When you pick up your prescription at the pharmacy, the pharmacist will also give you information. They might say, take this medication until it's gone, or refrigerate after opening. Listen carefully and ask if you're unsure about anything.
We're almost out of time, so let's quickly review some useful phrases you can use at the doctor's office.
Great idea. Here are some key phrases for describing symptoms. I've been feeling, it hurts when I have a pain in my, this started, and it's been getting worse or better.
What's causing this? How long will this last? When should I start feeling better? Do I need to come back for a follow-up? And is this contagious? That's a big one.
Yes, those are all excellent. Now, some quick tips. First, prepare before your appointment. Write down your symptoms, when they started, and any medications you're currently taking.
Second, be honest and specific. Don't downplay your symptoms, but don't exaggerate either. Give the doctor accurate information.
Third, bring a list of questions. It's easy to forget what you wanted to ask once you're in the appointment.
Fourth, if English isn't your first language, it's okay to bring a translator or use a translation app. Your health is important. Make sure you understand everything.
And finally, take notes during your appointment. Write down the diagnosis, the medication names, and the instructions. You can also ask the doctor to write things down for you.
One last phrase that's very useful is, I don't understand. Could you repeat that, please? Never be embarrassed to ask for clarification.
Never. Well, that brings us to the end of today's episode. We've covered a lot of ground.
We certainly have. We talked about common symptoms, how to describe pain and discomfort, what to expect during a doctor's visit, and how to understand your prescription.
Remember, the key is to be clear, specific, and honest when talking to your doctor. Don't be afraid to ask questions. It's your health, and you deserve to understand what's happening.
Absolutely. Practice these phrases before your next doctor's appointment, and you'll feel much more confident.
Thank you so much for listening to the Everyday English Lounge. We hope this episode helps you communicate better during your doctor visits.
If you enjoyed today's episode, please subscribe and leave us a review. And if you have suggestions for future topics, we'd love to hear from you.
Take care of yourselves, everyone, and we'll see you next time.
Stay healthy and keep practicing your English. Goodbye.
Goodbye.